Hello from Kauai, summing it up, Module 6. So this week we had two chapters that we worked on. We talked about antimicrobials and antivirals. Looking at our module chapter 7, we explored the differences between pathogenic and non-pathogenic bacteria, described various forms of bacteria, describe factors that are important in choosing antibiotic and antimicrobial agents. We're able to explain the difference between bacteriostatic and bactericidal agents. We're also able to explain how bacteria can acquire resistance to specific antibiotics. We know why antibiotics, antimicrobials, and antivirals and antifungals may be used prophylactically. We explored why some infections are best treated with a multi-drug regime and what a multi-drug regime is. We're able to identify and classify by families, antibiotics, antimicrobials, antivirals, antifungals, commonly used today. And again, one of the most important things that we do is patient education. So we're able to provide patient education for compliance with medications. And then we went to chapter 18 and talked about anti-neoplastic medications. We're able to explain the differences between curative and palliative uses of chemotherapeutic agents, classifying tumors by the tissues in which they originate, describe the roles of the allied health professionals in chemotherapy, and we talked about the importance of knowing the rules and following them. Describe how to safely handle and administer anti-neoplastic agents. We're able to identify and classify various chemotherapeutic medications, and we now know how to provide patient education for compliance with medication used in this area. I hope you have a great week, and I will see you in class.